Examination of the cardiovascular system. As with any patient interaction, to prevent cross-infection, the hands should be thoroughly washed and dried before coming into contact with the patient environment. When you first approach the patient, perform an inspection from the end of the bed, noting the general health of the patient and any useful clues which may give detail as to the patient's condition. The SUSE chart can be particularly helpful. Introduce yourself and confirm the patient's name and date of birth. You can verify this information by checking the patient's wristband. Explain what you are going to do and obtain verbal consent from the patient to proceed. To maintain dignity, draw the curtains or close the door before continuing. Begin the general examination with an inspection of the hands and nails. Note the temperature and quality of the skin and any signs present on the nails, such as splinter hemorrhages, koilonychia, or nicotine staining. Check for clubbing, first by assessing the fluctuance of the nail bed and looking across the nail angle. Ask the patient to bring the nails of 2 fingers together and observe for a gap in between the two, which is a normal finding. Examine the palms for erythema or paleness and assess whether the hands feel clammy. Take the patient's pulse by placing your fingers over the radial aspect of the wrist. Count for 30 seconds and double to give a rate in beats per minute. Also note the rhythm, character and volume of the pulse. Check for delay between right and left by feeling both radial pulses simultaneously. Verify that the patient has no pain or immobility of the shoulder before testing for a collapsing pulse. Place all fingers of one hand over the wrist and raise the patient's arm into the air. Note if you feel a bounding pulse in your fingers. At this point, you should also check the blood pressure before continuing to inspect the face. Observe for malar rash. Look around the eyes for signs such as xanthelasma and check the conjunctiva for anemia. Look in the mouth for signs of central cyanosis. Reposition the patient to inspect the neck for a raised JVP. Ask them to relax into the pillows with the bed at 45 degrees and turn their head away from you. Carefully inspect the neck just above the clavicle, in between the heads of the sternocleidomastoid muscle, for a bifid pulsation which is non-palpable. The JVP can be briefly enhanced through the hepatojugular reflex. Verify that there's no tenderness over the liver before pressing firmly but carefully on the abdomen, just below the rib cage on the right hand side. This will cause a rise in jugular venous pressure, which is clearly visible in normal individuals. Ask the patient to expose the chest by removing any clothing and carefully inspect the precordium for scars, deformities, and other abnormalities such as the presence of a pacemaker. Palpate the chest, first identifying the location of the apex beat. You should begin in the most inferior lateral position towards the axilla and work towards the normal location of the apex beat in the 5th intercostal space mid-clavicular line. Attempt to locate the apex with a single finger and verify its position. Place your hand on the chest at the lower left sternal edge to feel for heaves, and place the hand laterally across the location of the heart valves to feel for the thrills of palpable murmurs. Proceed to auscultate over the 4 heart valves. Begin with the mitral valve at the apex. You should listen with both the diaphragm and the bell at each location, noting the presence of normal heart sounds 1 and 2, as well as any splitting, added sounds or murmurs. Feeling the carotid pulse at the same time will help to identify the timing of any added sounds. Proceed to listen to each of the other 3 valves. The tricuspid is located in the fourth intercostal space at the left sternal edge. The aortic valve is in the second intercostal space at the right sternal edge, and the pulmonary valve is in the second intercostal space at the left sternal edge. The precise order in which you auscultate the valves is unimportant, and you may see it done differently in the clinical environment. However, you must listen to each of the 4 valves separately. Listen over the carotid arteries in the neck for the bruits found in aortic stenosis. A breath hold from the patient will eliminate any other sounds so that you can hear bruits more clearly if present. By rolling the patient onto their left side and listening at the apex with the bell of the stethoscope, the murmur of mitral stenosis will be accentuated. Check for aortic regurgitation murmur by asking the patient to lean forward, exhale and hold, and listen over the lower left sternal edge with the diaphragm. Whilst the patient is sat forward, listen to the lung bases for crepitations, which may be present in the case of heart failure. You should also check for signs of sacral edema. Recover the patient's chest and ensure that they are comfortable before continuing to examine the lower limbs. Expose the legs and inspect each carefully, noting the quality of the skin, any hair loss, and signs of ulceration which may be seen in poorly vascularized legs. Check between the toes and note any discoloration. You should also check the skin temperature. Check for the presence of peripheral pulses, starting off with the femoral pulse. You should check each side and note the presence and quality of the pulse. Proceed to check in the popliteal fossa behind each knee. Check the posterior tibial pulse just behind the medial malleolus and the dorsalis pedis just lateral to the tendon of hallucis longus. Brief extension of the patient's big toe will help to identify this landmark. If none of these pulses are present in one or both legs, it is indicative of peripheral vascular disease. Check for pitting ankle edema in each leg, also noting any visible swelling. You can also perform a brief test of capillary refill time by pressing firmly over a big toe for 5 seconds. You will see pallor in the nail bed which should return to red within 2 seconds. Berger's test can be used to further assess peripheral vascular condition. Raise the leg to 45 degrees and hold for a full 2 minutes, noting whether it turns pale compared to the other leg. Ask the patient to swing their legs over the side of the bed and watch the pale leg. A poorly vascularized leg will flush red with returned blood flow. Reposition the patient so that they are comfortable in the bed and recover them fully. Thank them for their time and fully explain any findings before recording the examination in the notes and arranging any further tests. Wash and dry your hands after the examination before moving on to a different patient environment.